If you are trying to have a baby, then you have to make sure that all the parts of the reproductive system are working right. Your ovaries need to produce an egg every month, the uterus has to be in good shape, and fallopian tubes, they have to be open. If the fallopian tubes are blocked, the sperm won't be able to reach the egg, or the fertilized egg won't be able to get into the uterus. HSG, जिसको एक normal language में हम Hysterosalpingogram बोलते हैं, this is a procedure that needs an X-ray to find whether the tubes are blocked or not. Timing, इसको कब किया जाता है? The timing of this procedure is very important. It is done after the periods are over and before the ovulation period. Preferably day 7, day 8 or day 9, because we are sure at this time the patient is not pregnant. So normally speaking, it is done on day 7, 8, 9 or even later, but before 14th day definitely, because we are sure that a woman is not pregnant. Now, how to prepare the patient? This procedure can be done under mild analgesia. You will be asked to take a painkiller about 1 hour before the procedure, but if you don't want any pain, then we can call an anesthetist and he will give you 1 injection and you will sleep for 5 to 10 minutes, and after that you will be up. So in order to avoid the pain that a patient is absolutely comfortable, this procedure can be done under anesthesia or mild analgesia is sufficient. Now how it is done? You are made to lie on a table in the lithotomy position, and a speculum is inserted into the vagina to make the vagina open, and the cervix is visualized and cleansed. A thin catheter called as HSG catheter, this is put into the uterus through the cervix, and a dye containing iodine, this is put through the cannula into the uterus. The iodine contrasts with the uterus, and on fluoroscopy and on X-rays it is visualized. The dye will pass through the tract wherever it is open, and if it is closed, the dye will not pass beyond that blocked point. So the X-ray films are taken, and the contrast liquid will then show the outline of your uterus and the fallopian tubes, and the fluid will pass only through the open tract, and if it is blocked, it will not go beyond that. Now, what are the risks of this procedure? HSG is relatively safe. The risks of this procedure are very less, but sometimes allergic reactions can be there with the dye. Some pain, cramping, stomach discomfort, constipation after the procedure sometimes can be seen.